Says I'm not present. Welcome back. Is it Wednesday? I think it's Wednesday. It's hump day. How perfect. So welcome back for those of you who have been following this week on our little tour. Wow, I didn't even know that was on. Okay, welcome back to our little tour of the male and female reproductive system of dogs and cats this week. And today we are going to talk about congenital anomalies, which are weird things that we have seen in our veterinary career, where things don't quite go the way they're supposed to. So I have a guest with me today, Dr. Laurie Coger, who practices in New York near Albany, I believe. And she has done a lot of surgeries in her lifetime, and I think worked with a lot of shelter animals, as have I. And so that gives us a bigger opportunity to see more weird things. So, Dr. Coger, thank you so much for agreeing to join me today to talk about all things weird in the animal world. Well, some things weird in the animal world.
Thank you. It's a pleasure, Judy.
So, how much spay neuter work do you do for shelter animals? Like when I had my practice, we were a mile from the county shelter. And so they would never, well, they used to release dogs and cats for adoption with a signed contract and a prepayment for spay and neuter. They did that for about 10 years and then discovered that only 33% of the animals were actually coming back to use their spay neuter certificates. So that left 2/3 of the animals intact, and that wasn't working very well. So then they started a new program where they contracted with veterinarians in the county. And so Wednesday was our shelter day, and they would bring us anywhere from 6 to 24 animals to spay or neuter. So it gave us tons and tons of experience. And then I used to do on my own low-cost spay neuter clinics for cats. We would do about 50 in a day. So gave lots of opportunity to see all kinds of different things. So do you do much shelter work up there? Are you doing a lot of spay neuter?
We actually don't spay at the clinic that I work at for the shelter, because the shelter has their own staff veterinarians. Okay. So I was the staff veterinarian at that shelter for a total of about 5 years. Okay. So I did all of their procedures for quite some time. And intake each year at this big shelter, Mohawk Hudson Humane Societies, about 14,000 animals.
Wow.
So it's a high volume sort of thing. And wow. Once they put in the veterinary facility there, it was vets coming in. So yeah. There's always a full-time, and there are a couple of part-time folks that come in and do whatever needs to be done.
Great. Laurie, make sure your phone volume is off on your instrument.
Yeah, it should be off. Let's see.
She says she's off.
Oh, no. Okay, nope, is that better?
She wasn't off.
I thought I was off.
Okay, this happens. Mine was on at the beginning too. We fixed it. Okay. All right. So I have a great story about our shelter animals. And unfortunately, this is before the time of cell phones, before the time of being able to take pictures of everything that passes your path. Because now I just take pictures of everything, which is why my phone gets overwhelmed and inundated. But the shelter called and they said, hey, can we run this dog over? We're not sure if it's a male or a female. And of course, you get this phone call and you're like, okay, like how stupid are these people at the shelter? Male and female dogs are really easy to tell apart. Like, really? Like, who do they have working there? So when we get that phone call with cats are a little trickier, especially if it's a neutered male. Sometimes you can't tell the difference unless you're, pretty good with cats. So we were all laughing as we were waiting for them to arrive. And when they came in, they put this little 25-pound dog up on the table, and there was a penis. And I said, okay, that's a male dog. And they said, yeah, but not quite. And I lifted the tail and looked at the back end and I went, oh, those are girl parts. I went, okay, I understand the dilemma now.
Yeah.
So, just checking my phone because I think that something is not off over here. Oops, and I just lost Instagram, I think.
Yeah, it's just saying, I'm seeing comments that say that we're echoey.
We're echoing, and I think it's coming from my phone. See if you can get Instagram back. Sorry, Instagram.
Oh gosh, don't show me.
See, I think my phone is making the noise, but it's off.
You know, I'm hearing you in my earphones and on my computer.
Because the volume can only go so low.
Okay. All right. No problem. Hopefully we have it solved. This technology is over my head. So we do see, and I think this is much more common in dogs. Have you ever seen a hermaphrodite in a cat?
No, I have not.
Yeah, I haven't either. But I did see a lot of dogs. And it was interesting. I was writing a blog on this the other day, and I was like, well, let me look online and see if I can find any good photos of a hermaphrodite dog. Mm-hmm. And all the photos that came up were things like press releases and news announcements, like this dog from the shelter, you know, had both parts, but all they ever showed was the face of the dog. Right. That's no help.
Instagram is still commenting that the echo is bad.
Instagram is still getting an echo.
Should I leave and come back?
Like, there should be no external audio at all. It should take your head out.
Wait, do what? Is your computer volume off? I think it's coming from my phone. I don't know why.
Let's try it now.
It's as low as it can go.
My volume is as low as it can go.
Okay, let's Instagram. Can you tell us if we just fixed it?
Did we fix it at all? Or are we still bad? Dr. Laurie may have fixed it. Facebook, everybody says, is awesome.
Facebook, and the Facebook people are happy.
And I'm not hearing the echo now.
We'll get you fixed. Someone said fixed. Yes, thank you, Heather.
We did fix it.
From the Maine Coon. Thank you, Tundra Pups. Yes,
all right,
we
somebody
did.
Says that sorted it. Okay, yay. Sorry, guys. Technology, sometimes it just makes us a little crazy. All right, so hermaphrodites in dogs can be really interesting. So they're sterile because they've got mixed up chromosomes. But the interesting thing is they can have testicles, or they can have ovaries, or they can have one of each. So we still, even if they have external boy parts, we still went in to find those internal gonads, because we know if we have testicular tissue inside the abdomen, it has a really high chance of becoming cancerous because the body temperature is too high for testicular tissue. That's why it sits down in the scrotum. And when it's up in the body, it'll be too hot. So we still had to go through the whole procedure. And it's really is a search mission because
nothing's like it's supposed to be designed.
Right. Nothing's in the right place.
I did have one cat that on one side of her reproductive tract, and I say her, one side was an ovary, the other side was a testicle. And everything was abdominal. The entire tract was abdominal. And outwardly, she looked like a female.
Looked like a girl that had a testicle inside.
It was very clear.
Interesting. So sometimes things get really mixed up. So talking about kitty cats, because I spayed and neutered so many cats, I would say at least a few times a year, I would open up a cat to do a spay, and one side, the uterus would pop out with an ovary attached, get that side done, go to the other side, and it's like, there's nothing here.
Right.
Like, no uterine horn. Now, interestingly, when I was researching this the other day, the literature states that almost all of those cats where one side of the uterine, and this can happen in dogs too, where one side of the uterine horn is missing, there is an ovary hiding up there.
Oh.
Yeah. In the literature, it states that most of them still have an ovary up there. And I would say that 95% of the ones where I only found one uterine horn, I never found a second ovary. Now, did I miss it? Because it might have been rudimentary.
Yeah.
Was it maybe testicular tissue that was there instead? Because I never got complaints that, hey, this cat you spayed is still going into heat.
And we should pause and talk about that, because it can happen in cats and dogs. If you leave a little bit of ovarian tissue when you're doing a traditional spay, that animal can cycle again.
Yeah.
They're not fertile because you've taken out their uterus, but it really disturbs the dog owner when all of a sudden the dog is bleeding and acting like she's in heat and males are interested. And we had a few of those over the years.
Oh yeah.
And
There's
sometimes
always going to be one that
Yeah.
pops in. We had a couple of cats where it happened. And I remember I did about 100-pound middle-aged German Shepherd obese
Oh,
dog
geez.
spay. And of course, of all dogs to leave a tiny piece of ovary in there,
Yeah.
that was the one. So, and the
Yeah.
owners were really upset. So, because the dog was showing signs of heat, so I had to go back into this obese, huge dog and go
And
find
search.
that. Yeah, a year later, which that is much trying to find that little tiny little needle in the haystack
Yeah.
is much worse than doing the spay to begin with.
Yeah. And sometimes it's truly what we call ectopic ovarian tissue, meaning it's not in the traditional location. So not the surgeon's fault,
No.
but
But
the end result is still a search.
with everything that we've talked about this week, I'm like, oh my gosh, we should have just left that ovarian tissue there. Like that dog was actually in much better shape having some ovarian tissue
Oh,
there.
yeah. Yeah. Yeah.
But unfortunately,
Now-
owners don't want to deal with that.
No, and that's why they spayed the dog. Now, when you were doing work for the shelters, when you had your hospitals, how old were the puppies and kittens that you were doing, or dogs? Did you do pediatrics?
Oh yeah, we did a ton. I
So
wish we
did I.
didn't, but we had to. So the kittens, our rule was 2 pounds. If they were
Yeah.
less than 2 pounds, we wouldn't do them, which means 8 weeks. So kittens were generally done at 8 weeks, and puppies generally at 8 weeks as well, which
Yeah.
really, really stinks.
We both cringe now,
I know.
knowing what we know now, but we didn't know it then.
Right. But if I was
And-
still in practice, in my practice in New Jersey, I would still be held to the same process.
Criteria. Yeah.
Because that's what the shelter does. And, if I'm not
Yeah.
willing to do it, then the guy down the street's going to do it. So,
True.
but
Yeah.
pediatric spay and neuter, and that's another whole topic, but we don't like to do it because they get
No.
hypothermic and their circulation isn't as good. I mean, there's so many problems that can go wrong with
From
pediatrics.
anesthesia and pre-anesthesia onward.
Yeah, so a problem. So, so let's talk about male torti or calico
Oh
cats.
God, yes.
So they're really cool. They actually have two X chromosomes. They are sterile. They're either an XXXXY or an XYXXY. So
Yeah.
they're sterile because their chromosomes are pretty screwed up. But
Yeah.
we had a male calico who was just the coolest cat,
Mhm.
but he suffered with all kinds of other issues
Really?
his entire life. Yeah. His biggest issue was constipation. Didn't
Oh.
matter what we did with that cat. So I think he had some nerve innervation problems with his large bowel, because it started when he
Mhm.
was very young. So not only did he have, weird body parts that he wasn't supposed to have, he also had some other genetic
Yeah.
side effects.
Well, we know when there's one congenital abnormality that there's often more than one.
Yeah, absolutely. Absolutely.
So was he your hospital cat or a patient?
No, he was a patient, and
cool.
he lived a normal lifespan. They moved actually right before I retired, but at that time I think the cat was like 13 or 14 years old,
Mhm.
and he
Yeah.
had been coming to us since he was a little tiny kitten. So, and he was a really nice, really cool cat.
Yeah.
So we had a few over the years. He was the one that I just remember the most because he was a patient for a really long time.
Yeah. We had a couple of tortoise shells, not calicos. And, I think we fall into the pit of, oh, it's a calico, and we don't even look.
Yeah.
And my employer comes bopping around, and he's a cat guy. Dave is really cool. Side story about Dave, he was one person away from being the Dr. Pepper guy in the commercials and stuff back in the day. So, you know, if you kind of picture the Dr. Pepper guy, that's what my boss looks like. And he's bopping around the clinic with this tortoiseshell cat. And he's like, Loris, come here. And he whips the tail up. And it's like, wow, there's boy parts there. It's like, okay, what are you going to do with that? And he did neuter it. And I don't know, you know, would they still have enough hormone production to smell like a tomcat, to be
That's a good
spraying
question.
things?
That's a good question, because we neutered this guy.
Yeah.
Even though he was sterile, we did neuter him. Probably screwed him up even more.
Potentially, but you know, thinking of the sex hormones are wrong, is that testicle going to produce hormones, and will it be a normal hormone? But we
True.
didn't have the guts to leave them intact, so
Yeah, well, my clients
we'll never
didn't want
know.
theirs left intact. So again, yes, we'll never know. I think we need to do a poll, and it would be really interesting. I don't know how many, like, these male torti calicos. Like, I wonder if anybody has biopsied those
Yeah.
testicles to see, are they testicles, are they ovaries, or are they the ovotestes where they have both?
That would be very interesting to
I
do.
didn't
So the
find
next
anything
the
about
next
that.
one we neuter, we're sending it in.
There you go. There you go. Yeah, I
There you
didn't find
go.
anything about that in my reading, but that is an interesting question. And maybe I'm just way off base and they all just have testicles and that's what it is.
Yeah. Kathleen says calico males are like Klinefelter syndrome in humans. They have various tissues.
Along with
This
more
is
feminine
interesting.
cat
Thanks,
deposition,
Kathleen.
typically treated with hormones. Interesting.
Yeah.
Yeah,
Yeah, because
well,
when you think about all these accidents of development, they happen in people too.
oh yeah, yeah, absolutely. So let's see. I think the most common one that any of us ever see in practice is cryptorchids.
Oh gosh, yes.
Where either one or both testicles are retained within the abdomen. And so with shelter work, let's just say you have a cryptorchid who has retained testicles on both sides. You would look at that dog or cat and say, it's a neutered male.
Yes and no. Because let's say hypothetically it's a cat. There's an easy way to tell if it's not a kitten, whether it's intact or neutered. Do you remember? Which is expose the penis. The intact male will have these spines on the penis, the barbs on the penis. And when those are only present when you have testosterone.
So if you had 2 retained testicles, are they producing enough testosterone to develop that though? They
yes.
are. Okay.
They are. And of course, when you neuter those cats, those spines or barbs, I'm going to say atrophy, for lack of a better term.
Yeah, we'll talk about it more tomorrow when we talk cats, but
yeah,
I read a lot of studies about development in the penis of cats, depending on when they're neutered, like those 8-week-old neuters we're doing, they just never develop the.
Oh yeah, and I dread those because they come in with a urinary obstruction, and my catheter doesn't fit in.
Exactly.
And other veterinarians you may hear say, cats, it doesn't matter. And I think you and I are of the mind that it does matter, both in cats and dogs with these pediatric procedures.
Yeah. Oh, absolutely.
It's not a good thing. And in dogs, coming from show dogs and breeding dogs, the penis develops so much more. So if it's an adult dog, even a cryptorchid, they are much better endowed, shall we say, than the dog who was neutered, even if you look at a dog that was neutered at a year of age, their penis decreases in size. And if you have a comparison dog, you can easily tell the difference.
Interesting. So the big thing with cryptorchids, and I don't know if our blog has been released yet, but we have some information about cryptorchids in there. But so particularly for cats, we just neuter them. We go find, you want to get the internal testicle out. And so now that we're looking at the effect that these hormones have, and should we be leaving hormones in place, if I were in a holistic practice where we wanted to leave hormones intact, I would go in and get the internal testicle. And if there was
Mhm.
an external testicle, I would either leave it or do a vasectomy there.
Yeah.
Because that internal testicle has about a 75% chance of become a malignant tumor
A
later
problem.
in
Yeah.
life. So they're definitely a problem. But I started playing around with things with my holistic practice, and we started using herbs. I used epimedium, and we would use acupuncture, things like deer antler velvet, which stimulates stem
Mhm.
cells. And I would put these dogs on these therapies, and I would say 9 times out of 10, we could get testicles to drop by about 15 months of age.
Yeah.
So, if you have a dog and you don't really want to go through the surgery, but they've got a testicle that they're holding up somewhere, there are things that can be tried to try to get that to drop the rest of the way. And the fun thing about cryptorchids when you're doing surgery is it's sort of the search and destroy mission. Like, where
Mhm.
is that thing hiding? And I forget who I talked to. Oh, it was a client who sent me an email about it. And the veterinary practice insisted on doing an ultrasound prior to going fishing for
Mm.
that testicle because they wanted to know where it was. Now, I never did an
Yeah.
ultrasound to find it.
Uh,
It's like either I feel it in the inguinal area and I go
Yeah.
there,
Yeah.
or I go in the
Well,
abdomen and find it there.
right.
Um,
Right.
so
And that testicle can be anywhere from up by the kidney to the inguinal region. And we have actually got a picture of an inguinal testicle if we can put that on screen.
there you go.
So there, I know, I'm sorry the folks on Instagram can't see this, but we have the dog lying on his back. He's anesthetized for surgery. And as you follow down the side of his penis, where his legs come out to the side because he's lying on his back, the surgeon can feel a little bump there. And that's where that's how far the testicle made it. It almost made it home.
Almost. So
And
I love those. They're easy to
those
retrieve.
are a gift, aren't they? Because you just make a little skin incision and out it pops,
Yes.
as
It's not that
opposed to a
fishing around
lengthy
in
search.
the abdomen trying to figure out where did that thing land.
Yeah, yeah. I've also used a gonadorelin to drop them.
Oh, okay.
There's a hormonal option as well as your herbal option.
Very
Uh,
cool. Very, very cool.
So basically you're just trying to stimulate the cascade of hormone events that should have occurred in utero that made the testicle drop. And you can get some down. And
Is that dogs only?
dogs only. I've never tried it in a cat.
Okay. Yeah, cats we usually
Um,
just go find them.
yeah, yeah,
Not
and
too many
hope they're
people want to keep their cats intact. We'll talk about that too.
no.
But not too many people want to keep their cats intact. Okay. So, rectovaginal fistulas and urethrovaginal fistulas. These are a real problem. Basically, we have a hole that connects the rectum to the
Mhm.
vaginal vault.
Yeah.
Not cool because you got
No.
poop and pee coming out both holes.
And yeah, the future is not a good thing. And
Future
you're
is not
talking
bright.
about reconstruction of very delicate tissues if you're going to try to fix it.
Yeah.
And if there's scar tissue that forms, you could cause more problems than you even had before.
Right. Yeah, I didn't.
How many have you dealt with?
I only had a few that I saw in 36 years, and they always got referred to a surgeon or
Yeah.
a university setting because if you want to attempt that repair, that's not a surgery for general clinicians. That is
Yeah.
definitely a very specialized surgery because if we don't fix that hole between the two, urinary tract infections are a given forever.
Mhm.
Like it has to be fixed.
Yeah. Yeah.
So,
As
okay.
well as difficulty defecating and all sorts
Yeah,
of other
there's
things.
so many issues. Hypospadia. Did you ever see those?
I've actually never seen one. Tell me about yours.
I think I've seen one, It's most common in Boston Terriers, and so they have an underdeveloped scrotum and penis, so they got tiny parts, and then they have an extra urethral opening out through the side of the prepuce,
Wow.
which is the sheath.
Right.
So the one picture that I found, and I didn't want to use it because I don't know if it's copyrighted. Basically, there were 2 holes in the prepuce, one on the side and one at the front in the normal spot. And so the urethra was actually coming out the one on the side.
Wow, that's bizarre.
So, peeing sideways.
Yeah.
So, I mean, the good news is I don't think that's something that's like life-threatening and going to cause a lot of issues. But
so urination was normal other than coming
sideways.
out the side. Okay.
Sideways.
Now what happened when the dog lifted his leg, I wonder? Where was it going to go? You better be careful where you're standing.
I guess it depends which leg it lifted. On the side that I had it or
Oh gosh, the poor thing could be lifting the wrong leg and peeing on himself.
Well, mine pees on himself and he's got normal parts. So mine just has brain function problems. So anyway, let's see. What didn't I cover on here? Oh, cystic ovaries.
Yeah. Yeah. We see those a lot. And, I work as the integrative vet in a very traditional practice. And so some of my colleagues are still recommending 6-month-old spays, but I would say half of us are on the page of 12 months, 15 months, 18 months. And yeah, they're seeing cystic ovaries on these dogs at 18 months.
Yeah.
A large number of shepherds are represented there.
Interesting. Yeah, I saw them in cats, dogs. They almost became commonplace, but it's really interesting. So, and I have a great picture in my phone that I saw the other day. Cat spay that I did, where one ovary was this little teeny tiny thing, about the size of the tip of my pinky, and the other one was the size of an egg. It just had, I had to make my incision bigger to get this cystic ovary out of the incision. It was so huge. And so when we have cystic ovaries, people who have cystic ovaries say that they're really painful. Maybe that explains why we have some grouchy animals. I don't know. Grouchy cats.
Yeah, it very well could be. And certainly when I would see them not that big, but at the shelter, and maybe the size of your pinky, and even in young kittens.
Yeah, it's amazing. I think that we're screwing up their hormones with endocrine disruptors in the food, and so many things. So many things.
Oh, I would agree. And I also see cysts. I have a fair number of breeder clients. And post C-section, a lot of times these girls will put all sorts of cysts out in the tissues surrounding the uterus.
Really?
And there's a picture. This is a spay. This was a golden retriever. She was done being bred. They elected to spay her. And as we pulled the uterine horn out right by the bifurcation where the 2 horns joined, was this mass of cysts. And the size of that would fill your 2 cupped hands together. And they were just attached all over the uterus where the previous incision had been to remove the puppies.
Wow, so that is amazing. I have never seen anything like that. So,
it was mind-boggling the first time I saw it.
Did you biopsy that? Like, is that did they become malignant?
No, they don't. I consulted a repro specialist who kind of just laughed at me and said, well, you just haven't seen them yet, but they're very common. Really? They're benign. And when I quizzed the owner, the bitch had cycled normally post puppies.
Wow.
And everything appeared normal. And we just found these when we went in there to spay her.
That is amazing.
They were amazing.
I guess I didn't do that many C-sections. Like, we would do a few a year, but I didn't do that many. And I would say that probably 90% of the C-sections that I did they spayed them at the same time because they
Yeah.
were like, yeah, we're not doing this again. So
Yeah,
generally,
which the American Society of Veterinary Theriogenologists, or whatever the board credentialing body is, has actually progressed to moving to recommending against spay at the time of C-section, assuming the uterus is healthy.
huh,
They've actually, it was a paper in their proceedings of their annual conference,
huh,
reasons why. And, normal hormones, normal lactation, normal recovery from the whole process of pregnancy, birth, and lactation really needs a uterus and ovaries.
yeah,
Even though it entails a second anesthesia, if you're going to spay because you're not breeding it anymore, it's a better option for the dog.
very cool, very cool.
Many emergency clinics will just automatically spay them.
Yeah,
And it's really just like pediatric stuff. It's really not in the individual's best interest.
interesting. Well, that's good. I'm glad. I'm glad to hear that. And I had a quote from the theriogenology group yesterday as well, talking about rethinking what we're doing and not automatically ripping out important body parts and looking at each one as an individual case. So very glad to see that we're moving forward a little bit. It's a very, very, very slow train, but
it is a slow train. But I think we both shared the article that was recently published in the Journal of the American Veterinary Medical Association, talking about the implications of pediatric spay neuter.
Yep.
I was thrilled to see that in such a mainstream publication.
We're starting to see more and more shifts in the field.
Yeah.
So yay.
Gives us hope.
Let's see. You had one more picture there. I think it's of a pio, which is not really an abnormality.
Right.
Is that what that was?
Yeah, that's
so
a pio.
This is not a congenital anomaly, but for those so normally the uterus is about the size of a pencil, the thickness of a pencil. And so sorry, Instagram, you can't see the picture, but this one is
probably an inch and a half in diameter.
Yeah. I mean, just
a few, it'll weigh a few pounds.
It'll weigh a few pounds. Yeah. I mean, I used to take out these 10-pound uteri.
Yeah.
Ugh. Awful.
And it's scary. And it's a reason that vets say you should spay your non-breeding females. I don't know.
We have a blog coming out on that as well.
Good. I'm jumping ahead.
Yeah, no, I did a lot of research on that last night and today on because we have great research out of European countries, Sweden and Norway, where they don't automatically spay and neuter everybody.
Right.
So we've got great statistics and we've got really large populations of dogs and cats that we can look at and see what the incidence of pio, cancer, all these different things, mammary cancer, that sort of thing, and really look at the incidence in a bigger population. I think what they've done here with the golden retrievers and the Rottweilers and the fistulas, where they had, again, a large population of intact versus neutered, and could really make those comparisons. So I think we need more and more of that research so that we can make well-informed decisions instead of just, well, it's always been this way.
Yeah, I think, we do a lot of things get done because it was traditional.
It's always been that way.
It's always been that way. And in the next room are my 3 girls and my old man. And I have 2 7-year-old intact girls and 1 daughter of one of them. She's 2 in a few months. And life is good. I'm not in a rush.
Yeah, absolutely.
So
cool.
So hey, thanks for the comments and question, guys.
Yeah. So I think the whole vet business needs to be changing. They do. We're working on it.
Well, that's why we're here, right?
Exactly.
All of us.
Do puppies?
And it comes from both sides. It comes from consumer demand
as well.
and veterinarians that are willing to listen and think.
Do puppies with both undescended testicles always have to be operated? Well, we hope that they come down. And so I give them a long time for them to come down. So waiting up to 18 months to see if they're going to come down, and maybe trying some of the therapies that we talked about, the epimedium, acupuncture, deer antler velvet, jing tonics in the diet from a TCVM standpoint. So I would give it plenty of time and see if they come down. But if they remain up in the abdomen, you got to go get them, because
I
they
think
have too
so.
big a chance of being cancerous. So unfortunately.
And also they will sometimes twist. It's called a torsion. And then their blood supply is cut off and you have dead tissue inside the abdomen, life-threatening.
Yep.
I did, as you were talking earlier about removing the retained testicle and leaving the other, we did have a couple state police dogs that were cryptorchid, and they insisted that we not remove the descended testicle.
Yay!
Because they wanted the hormones. And it made sense. They wanted the dog to retain the secondary sex characteristics and look big and scary. And they wanted the support that the hormones provide for muscle and attitude and everything.
Yeah, that's
And
great.
of course, they committed to not breeding that dog.
Sure.
Because we don't, this is an inherited trait, Cryptorchidism. We don't want to perpetuate it.
Right.
But that doesn't mean the individual can't keep their parts.
Exactly. This person says, I've had 3 cryptorchid males. One I found wasn't properly neutered and was an owner rehome due to being too focused on procreating. I had testosterone levels tested, found he was still intact. Though he had 3 incisions, they left the retained testicle in place. And I've seen those where the shelter or whoever, or the initial person who did the neuter, they'll take the one that's descended and leave the other one up there. If anything, you got to do it the other way around. You got to get that one out of there. So,
but I can understand, in a high volume shelter, you're just going, you took the descended one, you forgot you didn't go after the other.
Forgot, didn't know how, didn't want to be bothered.
Back when my second job at a veterinary school, I went to work for a 3-doctor practice owned by an old timer. And a cat came in to be neutered, and Doc was supposed to neuter it. It turned out it had an upper respiratory infection, so he canceled the surgery, which was perfectly appropriate. But somehow the communication did not reach the owner that they needed to reschedule. And the cat proceeded to go home. They thought it was neutered. It wasn't. It sprayed in their apartment. They lost their security deposit. And they came back in, and I, as a very recent grad, had to deal with it. And they're telling me this, and I'm looking at it, and it's like, beautiful tomcat, big, cheeky face, handsome.
Big testicles.
I picked his tail. I'm like, and they're telling me about how he's spraying and how he stinks. And I'm like, well, have you considered neutering him? I put on my white coat, professional face. Have you considered? Well, he's neutered. And I'm like, no, he's not.
See those things right there?
Yeah. And they're like, oh, we were told he was neutered. And I went back through the record, and it was clearly documented. And it was just human error. Yeah. And Doc stepped up. He paid their security deposit. He made it right.
Oh, that's nice.
He was a good guy. But mistakes happen. But I felt about this big, and I'm like, am I going to lose my job because I just cost the practice, a couple $1,000 by showing the owner her cat's balls?
Well, yeah, I mean, it was the right thing to do. So really interesting comment on here, Colleen Clement. When I worked at Cornell, we had a 5-year-old male schnauzer that came in on an emergency referral for acute abdomen at 2:30 a.m. The resident got into surgery and came running out in a panic to call in a faculty surgeon. It was a ruptured pyo, externally male, vagina drained into the large intestine. So the owner had no clue. Wow. And so Dr. Laurie, you might remember it. Not sure if you had graduated.
I don't remember that.
That is very interesting. So on the hermaphrodites, it is most common in miniature schnauzers, bassets, and Persian cats. So interesting.
That really is, interesting. It's so amazing that we have so many normals out there, that things work right most of the time when you start thinking about and seeing these things that are crazy.
Yep. There aren't that many of them, but if you do enough spays and neuters,
without a doubt.
After the first few thousand, you kind of go, yeah.
Mhm.
Another weird one.
Another weird one. Okay, let's just get it done correctly. Um,
Ugh.
and the shelters, of course, took on the practice of tattooing their animals after they spayed and neutered, because sometimes somebody rehomes a shelter pet, or it gets to become a stray and then is re-caught, and people don't know if it's spayed or neutered.
Right. Yeah.
And
I
if it
think
was a pediatric spay, you're
sometimes
never
there's
gonna,
there's
you're
no
not going to see
scar.
that scar.
Yep. Yeah.
Um,
Like my vet now that I use when she spayed and neutered all of our kittens, all the females have a nice little green line where she
yeah.
just put a little tattoo line in there. And I think that's something that's going to become more important if people are doing vasectomies or
Yes.
oversparing spays. We're going to need some way to identify these animals. So let's say that a dog that's had a vasectomy needs to be rehomed. How would you know
Yeah,
that
you
he had a
wouldn't.
vasectomy?
There's no way you could tell.
So, yep. So the times they are a changing. All right.
Yeah.
Dr. Laurie, thank you so much for joining me today to
Oh,
talk
you're so
about
welcome.
weird things in practice. I knew you would have seen a few over the years.
Yeah, absolutely.
All right, folks, we're going to sign off. I got to go home and feed a bunch of animals and take Forrest to his second puppy training class.
Oh, sounds like fun.
Oh, yeah. Pretty sure we might not pass, but it's okay.
There's still time. It's only class 2.
It's only class 2. We're working on it. He does at least not drag on the leash now. He follows me mostly. So
Oh, good.
it's an
Good,
improvement.
good.
It's an improvement. The whole sit command, he's very confused. I think I'm doing something wrong. I'm going to ask tonight. All right.
Sounds like a plan.
We ready to go? Yes, we are.